far. It depends on how severe it is. So I think we've got everybody on board. Yeah, you need to be close enough to have a look at your screen. So I'm going to take 3 to 5 minutes to have a look at. I'm going to share my screen, and it's my anatomy so that we can get a good look at what is it that we're talking about. Sciatic nerve, when it's inflamed or when it's trapped, it's referred to as a condition which is sciatica. It's very uncomfortable, sometimes very painful. So here we will have a look at what is it that we do, especially the supine twist. What is it that we do as remedial yoga to any conditions like sciatica or hip pains? Maybe muscles are overused or underused. So supine twist keeps coming back. So here is my skeleton. I'm just turning him around and we get a view from the back. I'm going to bring him in a little bit so we get a bit better view. Sideways, a little bit up. Okay. So looking from the back, we start with, if I can bring all the muscles in. So we start to see the back. I'll just overlay it with the skin so we know this is where we are. Below the skin, yes, there is the epidermis, yes, there is lots of fascia. As soon as I get rid of the skin, then we come to the muscles. We start with observing and working with understanding the muscles that we are using and working. The most strongest muscle in the body, the gluteus maximus. Layer 1, you know that there are 3 layers of it. Maximus, I'm going to take them off. Medius, again, left and right pair, allowing rotation, lifting legs sideways, abducting. Hide those, and then we come to the minimus. And they are also quite strong muscles, allows a lot of range of movements, plus the upright posture of as much as possible. Okay, so that's us looking at the sacral bones area, which is the area we'll be focusing in as we work a little bit more. Bear with me on this. Let's just go and identify the spine. So once again, every time we do our yoga postures, I come up and say, well, there are 5 layers of muscles below the skin. So there's the skin again. Get rid of the skin. Latissimus dorsi, layer 1. The serratus muscles, layer 2. And if I hide that, let me just bring him down a bit more. And there's the longissimus, both sides of the spine. We still haven't seen the spine. That's layer 3. Then quadratus lumborum, iliocostalis lumborum. Hide that. By then you start to just about see the spine, but still covered are the multifidi, small, tiny muscles. These are the ones that engage first. Any time, any movement taking place in the body, multifidi are the first ones to engage. So keeps the spine rigid or able to lift the upper body, lower body. I've just got rid of the multifidi, and you now start to see the lumbar vertebrae. Okay, so below the 5 layers. Let's go back into what we were talking about. May have to zoom him out a little bit. Okay. So here, if I start to now add, well, get rid of all the muscles. Let's just go and we can get the blank bones only. Okay. So if I now add the nervous system, so all the nerves are beginning to appear. Let's just get a good understanding of that. So all the yellow ones, miles and miles of nerves within the body. The one we're talking about, I'm very interested in, is the sciatic nerve. So I'm going to move him up a little bit, zoom him in a bit more, and there you have a major sciatic. This is the right, sciatic left, and they go through to the thighs. Move him up a little bit. So sometimes the sciatica is, and the tingling is on outside of the thighs or insides of the thighs, but then it further splits and goes all the way down to the toes. By the time you get tingling in the toes, the issue may be a little bit more severe than just trapping of the nerve. I say just trapping of the nerve. It's simply a wrong kind of movement that may sometimes just block the messages running through the sciatic nerve. And when there is a blockage, obviously there is a little bit of pain. So here we are. You can see exactly the area we're talking about, lots of nerves. And we've been through the layers of muscles, especially the glutes, and we will arrive at what we normally do to stretch these areas where my cursor is at the moment. The muscles first, and then below the muscles, the lumbar nerves on the top here, and then the sciatic nerve through the base of the sacroiliac joint and the sacral bones. So sacral bones are just flat vertebrae. You can see lots and lots of tendons and ligaments in that area, but that's a different subject. Let's stop at that one and go back to our normal class. Stop the share. Get back to full screen and put myself on the main. Okay. So as always, we are going to start with sitting comfortably, cross legs. Position yourself so that we can work with our usual postures. And when we do the supine twist, I'll remind you of the images that you've just seen. Cross legs, backs of the wrists on the knees, index fingers and the thumbs link up. This is our usual routine where we begin to connect with the body. With eyes closed, we begin to focus on our breath. As we breathe in, the ribs move. Wherever there is movement, there is energy. So work with that. Move out. As you breathe out, ribs go back towards the spine. Ribs at the back also moving. Those 5 layers of muscles are being stretched as you breathe into the back of the rib cage and the lungs. Gently open your eyes. We start with working from the head, shoulders, down through the spine, and then we'll work with our supine twist. So a simple twist so the entire spine moves. Right hand on the left knee. Left hand forward. As you push it forward, you know the shoulder joint is moving. Then take the hand up, push it up, shoulder joint again working, and drop the hand behind you. Fingers in pyramids, so fingers are working too, and a good proud posture. Hold the knee with the right palm, and as you breathe out, begin to twist
And start to take your chin as close to the left shoulder as you can. Eyes are closed. You're beginning to observe the stretch you feel on the skin on the left-hand side of the rib cage. Deeper muscles being activated. All those 5 layers at the back and 4 layers at the front. Use the strength in the arm that's holding the knee to go that little bit further around. Eyes all the way to the left behind closed eyelids. And nice and slow, come back. Hand on each knee. Lift the shoulders, roll them back. Feel the shoulder blades gliding down the back. Do the other side. Left hand on the right knee. Right hand forward, exaggerate. Push it forward so the ball and socket joint at the shoulder works. Then take it up and then push it up a little bit. And drop the hand behind you, fingers in pyramids, pressing down, getting that proud posture. Breath into the lower parts of the lungs. As you breathe out, start to twist, taking your chin close to the right shoulder. Eyes are closed. Eyes all the way to the right. Let the muscles behind the eyeballs work as well. Breathe. Feel the skin stretch. Use the strength in the arm to go another millimeter around. And come back out. Hand on each knee. Collarbones lifting. Shoulders lift. Shoulder blades glide down the back. Just with the neck, the cervical spine. The rotation. Chin tucks into your chest, into the sternum area. Slowly take the chin towards the left shoulder. Eyes are closed. Chin up towards the ceiling. And to the right shoulder. And back to the chest. Keep nice and slow. Continue the rotation. Chin, left shoulder. Chin, ceiling. Right shoulder. And the chest. There may be a few sounds in the neck. Chin to the shoulder. Ceiling. Shoulder. Chest. Change the direction. Chin towards the right shoulder. Ceiling. Left shoulder. Chest. 2 more rounds. Shoulder. Ceiling. Shoulder. Chest. 1 more. Shoulder. Ceiling. Shoulder. Chest. Coming back to the center. Eyes open. And spine as upright as it's going to be. Okay, going back to the image, below the skin, you know we had 5 distinct named layers of muscles. They're not like blanket-like structure, but they are individually shaped. We stretch those out. Move the feet forward by a good couple of inches in front of you. Then your palms onto the shins. Use the strength in the arm to see if the collarbones will lift at the front and your lower back beginning to arch. You can feel it. And then on an exhalation, pull yourself forward, allow the belly to go between the thighs. This is a very familiar posture to most of you. Tuck your chin in, forehead going towards the mat. If it feels okay, plant the palms on the mat, walk them up towards the top of the mat. And then see if the elbows are ready to drop to the mat, but touching the fronts of the feet. It's an enormous stretch from above the hips to the back of your head. Those of you who wish to take it further, use your breath. 2 breaths. As you breathe out, pull the belly muscles in towards the spine and feel the opening at the back. Let go of the belly muscles as you breathe in. Exhale. Pull the belly muscles in. And slowly lift your face, walk the hands back, bring the feet a bit closer to the pubic bone, hand on each knee, and just an upright spine, chin slightly tucked in. In, breath out. So we work the sides of the spine, again, very familiar postures. Now it's about building the distance. Your right palm drops in on the outside of your right hip. Left shoulder, lift it up, exaggerate, bring it up to the ear, rotate at the shoulder joint, and then open the palm wide. Looking at your left palm, start to draw the left hand up, allow the right palm to slide away. And as we build the distance, you might even drop down onto the right elbow. But the left buttock stays on the mat. So getting an enormous side stretch, looking up at the ceiling. Awareness into the left lung. Take a deep breath in and hold. Through the mouth, side out. One more. Breath in and hold. And release. Come back up. Left palm drops onto the outside of the left hip. Right shoulder lifts up towards your ear. Roll it out. And then look at the right fingers. Start to draw the right hand up. Slide the left palm away. And you observe one side may be easier than the other. If possible, your left elbow is on the mat, but the right buttock is still on the mat, looking up. Awareness into the right lung. Breath in and hold. Side out. In and hold. And let go. Coming back. Hand on each knee. Lift the shoulders. Roll them back. Breath in, breath out. So we go down the spine, now towards the lumbar spine and the sacral bone, sacroiliac joint, where we saw how the nerve coming out of the spine and the sacral bones and working its way underneath the glutes and all that. So, standard supine twist. Lying down, looking up at the ceiling, and if possible, going into a full relaxation posture, allowing the feet to flop a bit to the side, allow the palms to face up towards the ceiling. With your eyes closed, you can feel your shoulder joints at the front rolling away from each other. That works with opening the Anahata chakra, the heart energy region. Nothing to feel, just to know there's an energy region, a chakra, a wheel of energy. Okay. You might want to go with eyes closed and see if you can keep the image in your mind. Our supine twist, Supta Padangustasana. For me, this is one of the best possible postures in my life. Make a habit of using this as much as you can. Arms go wide in line with the shoulders, palms facing up. Bend at the knees and plant your feet on the mat. Feet are hip width apart. Right foot goes on top of the left knee, and the right knee is guided away from your face. So you're building that figure of 4. Our image, our awareness goes to what you've just seen. 3 layers of glutei, the piriformis muscle, all the range of muscles at the back. We'll be stretching all of that to release the sciatic nerve. Left knee, bring it towards your face. Reach, grab hold of the back of the left thigh, reach through the figure of 4. So the left glute, and then as you straighten out the left leg, the upper hamstrings at the back, upper back of the thighs, they are stretching. When you're ready, you lift your head towards the right ankle and you become aware, where is the body weight? The sacroiliac joint. Yes, layers of muscles, skin, but what you're doing now is stretching those glutei and the piriformis muscles around the sacral bone region. Forehead coming up. Use the strength in the arms and the shoulders to come up as much as you can. And then slowly let the head go back down. Let the left foot go back to the mat. Open the arms wide in line with the shoulders. Eyes remain closed. Next time you breathe out, both the knees towards the right elbow. Slow as you like, and with your eyes closed, you're beginning to feel the stretches that are taking place. And with the images we've seen, you know the right hip, ball and socket joint region. All the muscles around there are stretching away from the hip towards the left knee. Yes, awareness goes to the left armpit, the left side of the rib cage, the large descending intestine. Don't want to lose the importance of this posture. But it is at the moment working on the sacroiliac joint and stretching the muscles that from time to time trap the sciatic nerve. Release that a little bit more. Your left leg, straighten it out. Take it all the way to the right side. And as you glance at the toes, can they come close to the right set of fingers? So again, the long muscles, longissimus and the quadratus lumborum, remember, alongside the spine, they are now getting an extra stretch, plus the glutes, plus the piriformis, plus the sciatic nerve, and all the lumbar region. Pull the left toes a little bit further towards the right fingers. And slowly bring the left foot back to the center of your mat. Continue that twist at the spine. Your eyes are closed. Take both the knees towards the left elbow. When the right foot drops to the mat or the floor, you reach with the left palm. Begin to use the strength in the left arm to guide that knee closer to the floor. Some of you, the knee may already be on the floor. And you know now the muscles. This is now the right side. So we'll be returning to those, but you can begin to visualize the image you have in your mind Below the skin, the muscles are on the move. So are the joints, so are the nerves, of course, the arteries and the veins. Keep pulling the knee down. We hold this posture a bit longer because of that fifth layer of the muscles, the multifidi, scores of them, tiny, tiny muscles. Keep pulling the knee down, engage with the right set of fingers, and you allow your awareness to drift because your hand is going up towards 12 o'clock. Upper right-hand side of the chest area is stretching, the armpit is stretching. You know the lymphatic system is being used to its maximum. The drainage system of the body. Next time you breathe out, right fingers, push them a little bit further away from the right shoulder. Start to bring the right arm, perfectly okay to leave it in line with the right shoulder. As we've built the practice, take that right hand and find the front of your left foot. Once you've got a good grip on the left foot, focus back onto the shoulder blades. Guide them both onto the mat. You're looking up towards the ceiling, even your eyes are closed. Then, very deliberately, the cervical spine, the neck, turn your head, look to your left, and begin to straighten out the right leg. Support the back of the knee with the palm. And then lock that right knee in. Remember the challenges of the upper hamstrings. You won't be able to do this if the hamstring has been damaged. And unfortunately, the upper hamstring usually takes between 1 to 2 years to mend. Very debilitating in terms of pain and not being able to do things you want to do. Use the strength in the left arm. Bring the toes a little bit further up in towards the line of sight. And let go. Come back to the center. Keep the knees bent. Plant your feet on the mat. Let the arms go wide in line with the shoulders. Eyes are closed. And then your awareness. You know the right side of the body, the glutes, the piriformis, the longissimus, the quadratus lumborum, the serratus muscles. All of them had wonderful chance to stretch. If you do this at this pace, we're talking about between 10 to 15 minutes of a workout. If you do it twice a day or twice a week, the body is being maintained. Left foot on top of the right knee. Guide the left knee away a little bit. Next exhalation, right knee comes up towards your face. You reach through the figure of 4, grab hold of the back of the thigh. You know that's where your upper hamstrings are. There are 5 muscles at the back of the thigh. Start to straighten out the right leg. Show the sole of the foot to the ceiling. Take it that little bit further. As you breathe out, forehead towards the left ankle. And your body weight on the sacroiliac joint. Yes, all those muscles before you see the bones, they are being pressed, allowing them to release energy, release tension, release stress, whatever you want to look at it as. Forehead close to the ankle. Awareness to the weight of the body. Where is it? And slowly let the head go back down. Plant the right foot onto the mat. Open your arms wide in line with the shoulders. We continue. Sciatic nerve, sacroiliac joint. With the eyes closed, slowly rotate at the lumbar spine. Take both the knees towards the left elbow. And you become aware of the stretches. Right armpit, right side of the rib cage, the large ascending intestine. We mustn't lose sight of things like that. Posture works much deeper than just the sciatic nerve region. Patience, breathe. Is the belly area moving? Is the lower parts of the lungs and the diaphragm work? Right leg, begin to straighten it out. Take it all the way to the left side of your mat and begin to guide those toes towards the left fingers. So all those long muscles right through to the back of the neck and the head. They all participate in any discomfort in the back. Let them stretch a little bit more with the toes, little bit more. And bring the right foot back to the center of your mat. Continue to twist at the spine. You're now moving the lumbar spine through its maximum rotation. Both the knees towards the right elbow and the left foot drops onto the floor. That's when you reach with the right hand and begin to work with the muscles at the back of the hip joint. Pull the knee down, use the strength in the right arm, bringing the knee as close to the floor as you can. And our awareness goes to those multifidi, the tiny, tiny muscles that showed up when we were down to the fifth layer of muscles. Let that area work away and stretch. Engage with the left set of fingers, open them wide, and begin to draw the left hand up towards 12 o'clock. 2 o'clock and 1 o'clock is fine, but if possible, upper arm touching the side of your face. Fingers are wide. You know there's tingling, all the nerves working. Next time you breathe out, push the left fingers a little bit further from the left shoulder. And start to bring the left arm back in line with the left shoulder, if that's what you did on the right side, or go and find the front of the right foot. Once you've got a grip on the right foot, focus back onto your shoulder blades. Make sure both of them are on the mat. Back of your head is on the mat. And then a deliberate twist at the neck and look to your right. And start to straighten out the left leg, supporting the back of the knee with the right palm, knowing the glutes, all the three layers of it, the piriformis muscles and its support gang, everybody stretching. And the sciatic nerve from that sacroiliac joint, remember the blue nerve, all the way, passing from near your palm, right palm, all the way to the toes. So we're dealing with the whole of the sciatic nerve, not just the upper one. Bring the toes a little bit further to line of sight. And let go. Keep the knees bent, plant your feet on the mat. Let your hands go by the side of your hips. Again, palms are facing up. You begin to join the soles of the feet and let the knees drop to either side. So, The muscles at the back, which we saw and we stretched, are now being squeezed, if you like, not deliberately, but just allowing the knees as they drop to the side to effectively massage the glutes and the piriformis. And that's why I say nothing to do but being patient. Very deliberately, can the knees drop another millimeter towards the floor? We stay with that region. Eyes are closed. Bring the knees towards each other. And then bring the knees towards your face. Reach, grab hold of the tops of your shins. And as you breathe out, bring the forehead up towards the knees. If you're okay with it, reach out, grab hold of the outer edges of your feet. And as you use the strength in your arms and your shoulder muscles, we've shifted the body weight slightly above the sacroiliac joint, the lumbar spine, and the thoracic spine junction. And those 5 layers of muscles are now getting body weight on it. Let the head go back down, slide the palms onto the tops of the shins. Keep your eyes closed. We're going to massage those layers. So be generous with this one. Slow 4 or 5 rounds. As your awareness goes there, of course, more energy follows. But slow, don't rush into this. Every little movement, cross massage of those long muscles is going to release lots of tension. Most of our tension is held in the back. So, one more round. Then you come back to the center, release your shins, and plant your feet on the mat. We're going to continue with the postures that enable the stretches of the muscles at the back, muscles at the front, and of course, working the legs. So still the focus is on the sciatic nerve. Sciatic nerve from the sacroiliac joint, below the glutes, along the backs of the thighs and backs of the calf muscles to the toes. So in your own time, you're going to roll to any one side, have a water break if you need one, but you're going to come up in a standing posture in the center of your mat. And you turn to the left or right, so you got the long edge of the mat in front of you. I'm going to stay close to the camera because I want you to see if you need to, you can use a block or a rolled up mat. So I'm going to place the block onto the mat. Move the camera a little bit so you can see what's going to happen. And I'm standing with my heels on the block. Now, that's not always necessary. Some of you are much more flexible, but toes, feet are slightly splayed, and then slowly go into a squat. Your elbows will come onto the insides of your knees. Palms are joined up. And as you bring the thumbs to the sternum, you're splaying the knees that little bit more. Now, if you can, you stay there, supporting the chin onto your fingers. Eyes are closed, and you'd build that image again. Sciatic nerve, the glutes, the piriformis, the muscles below the skin at the back. Spine comes upright. If this is difficult for you, then you come up. They don't have to do this. Work with awareness on this. And from there, continuing to stretch those muscles, we go into a simple forward bend. Release the palms onto the mat or onto the floor. Release the bum away from the heels. Start to push your bum towards the ceiling. Drop the head down. And the palms can be on the mat or on your toes or on your shins. Either way, let the head hang and awareness to the muscles at the back of your hips, back of your thighs, and backs of the lower legs. The gastrocnemius and the soleus muscles. Let them stretch. Push the bum a little bit further up. Palms go onto your shins, and you start to slowly release the posture and come upright and go into that Tadasana, where your feet are hip width apart, and we continue to build the strength in our legs and the back. So you're in the center of your mat, feet are hip width apart. Just so all of you know, there's a candle lit today and 24 red roses. It would have been Coral's birthday today, so I'm celebrating. Feet hip width apart, hands by the side, lift the shoulders, roll them back, and allow the palms to face forward. So when we drop into the feet, you'll be able to see quite a complex structure there, but very deliberately lift the arches of the feet. So active muscles. So we're going to do a reverse triangle and then into the bind. The two postures that I feel works the entire body. So you turn to your left or right and work your way to the one end of your mat with the full range of mat in front of you. This is, instead of the triangle, we're going to do the reverse triangle. So again, that spine, the muscles in the back, all of that will work. Hands are on the hips. Your right set of toes go towards 2 o'clock. And you step forward with the left leg. And instead of bending the knee, a slight hollow in the back of the knee. So the leg is almost straight, but not hyperextending. Torso upright, hips are facing towards the top short edge of the mat. Keep pulling the left hip back with the left palm. Right hand, stretch it forward, palm facing the floor. Then you stretch towards the wall on the side, and nice and slow, bring the right hand till it drops, either fingers in pyramids or palm on the mat. Left hand, left palm goes behind your back, palm facing away. Adjust the right hand as much as you need to, but start to twist and look over the left shoulder. And then extend the left arm out, fingers wide. So this is the reverse triangle. Legs are working, spine is working, shoulders are working, whole inner body is working. Bring the left palm down onto the outside of the left foot. Bend at the left knee, and then push back into a standing posture at the back of your mat. Feet hip width apart. Shoulders lift and roll back, and palms face forward. Breath in, breath out. There we do the other side. Hands go to your hips, left set of toes towards 10 o'clock, right leg more than a leg length forward, but not bending the knee for the warrior kind of posture, but allowing a little bit of hollow so the muscles in the leg are active. Helping the hips to face the short edge of the mat in front of you. Keep pulling the right hip back with the right palm and extend the left hand out in front. Reach towards the top of the mat, and then as slow as you like, bring the left palm onto the inside of your right foot, and your right hand goes behind your back, palm facing away. So there is a little bit of a hollow behind the right knee, no hyperextension. Next time you breathe out, twist, look over the right shoulder. And then extend the right arm up. Fingers wide. And allow the fingers to disappear a little bit from peripheral vision. And bring the right arm onto the outside of the right foot. Bend at the right knee. Push back into a standing posture at the back of your mat. Lifting the shoulders, rolling the shoulder blades down, palms are facing forward. You know the arches of the feet are active. Breath in, breath out. So we continue to build our posture. The really strong one is the bind. Talk you through, you just work as much as you can with as far as you want to go. You're at the end of your mat, full length of the mat in front of you, hands are on the hips, right set of toes towards 2 o'clock, left leg more than a leg length, and then you start to bend at the left knee as if you're going to go into warrior two. So now the knee being over the heel is the critical bit for the cruciate ligaments. Torso is upright at the moment, hands are on the hips. Next time you breathe out, start to rotate forward from your hips. Your belly is going onto the inside of the left thigh. You're looking at your mat, and then release the palms. Both the palms drop in on the inside of the left foot onto the mat. Take a quick glance at the right foot. Make sure the arch is working. So you know the leg muscles are all active. As you breathe out, start to elbows towards the right foot. So you're bending your elbows towards the right foot. Left hand goes from underneath your left thigh. Right hand goes from above, and at the back, find the wrists or interlock the fingers, wherever you are. And then twist. Look over the right shoulder. Drop the hips a bit. Back leg nice and strong. And look at the mat. Drop the palms on the mat. Right heel comes up. And then step back. Left leg goes back. And you're at the back of your mat. Feet hip width apart. Shoulders lift, shoulder blades glide down the back. Breath in, breath out. Do the other side. Hands go to your hips, left set of toes towards 10 o'clock, right leg, leg length and bit beyond, and you start to bend at the right knee. And the main purpose is to check the alignment. Right knee over the right heel. That bodes well for the cruciate ligaments. As you breathe out, rotate forward, belly going onto the inside of the right thigh. Both the palms drop in onto the mat on the inside of the right foot. Check the arch in the back foot. Move it around if you need to till you see the arch is active. And then slowly bend the elbows towards the left foot. Right hand feeds from underneath. Left hand goes from above. You either find and hook the fingers or the wrists, some of you. On an exhalation, twist, look over the left shoulder. Drop the hips a little bit, front leg working. And release. Come back. Palms, lift the left heel at the back. Drop the left knee to the mat. Pull the right foot back. Go and sit back on the backs of your heels with the hands dropped to the side of the feet. And if your arms are long enough, you're beginning to massage the arches of your feet. In and out. Stay with stretching the muscles front and back. So familiar posture again. Eyes are open. Start to lean back a little bit. Plant the palms on the mat. Allow the fingers to face towards or point towards the knees. Then exaggerate. Bring the shoulder blades towards each other. Lift the sternum and look up at the ceiling. Awareness to the very tops of your lungs. Breath in and hold. And side out. Another one. Breath in and hold. And start to release. Bring the torso upright. Hold on to your feet or the sides of your hips. But continue to fold forward. Belly goes onto your thighs. Eyes are closed. Chin tucks in. Forehead towards the mat. And then allow the elbows to go towards the mat. With your eyes closed, you can visualize what's below the skin at the back. The big latissimus dorsi, the big muscle. And then you saw the longissimus, the quadratus lumborum, the serratus muscles, and also the multifidi, close to the spine. They are all in full stretch in this simple posture. And start to lift your face. Come up with the spine. Shoulder blades come towards each other. In. Breathing out. One more posture. Still everything to do with stretching the back from the heels to the back of your head. So wherever you are towards the back end of your mat. Legs are stretched out in front of you. Toes are pointing up, pushing the heels towards the camera and pulling the toes in. So you know there is a good stretch at the back of the legs, especially at the back of the thighs, the upper hamstrings. And then supporting the backs of the knees, open the legs as wide as you can. Some of you with your hips being more mobile, you'll be opening them nice and wide, but the toes continue to point towards the ceiling. So now we're going to stretch from the heels, all of the layers of muscles below the skin to the very crown of your head. but keep it simple. You're listening to your body. At the moment, you're holding your shins. And then as you breathe out, you start to pull forward, walk the hands towards the toes, maybe placing the fingers onto the toes. And then on an exhalation, start to draw the forehead towards the mat. You immediately feel the stretch from the backs of the heels all the way, upper back, lower back. If it's available to you, reach out, right palm on the outside of the right fingers on the outside of the right foot, left fingers on the outside of the left foot, but the knees are close to the mat. Forehead drops a little bit as you breathe out. And slowly begin to release. Palms on the shins, coming back up, supporting the backs of the knees. Bring the feet in and plant your feet on the mat. Just going to move a bit sideways. So having stretched those muscles at the back, we squeeze the muscles at the front and the core of the body. So we use the boat posture to work those core muscles. Lean back a little bit, find the sitting bones. So you know, again, sacroiliac joint, the sciatic nerve, the glutes. Wherever you found your sitting bones, hold the backs of the thighs and shins go parallel to the ceiling. You're still supporting the backs of the thighs. If it feels right, release both the hands parallel to the shins. Lean back a little bit towards the sacroiliac joint, and then start to straighten out the legs. So you're in a full boat posture, Navasana. Pushing the heels, pulling the toes in. And some of you take it a bit further. Both the hands go behind your head, interlace the fingers, let the legs go down to 15 degrees, and the back of the head is 15 degrees off the mat. So the front core, everything is working. And a little bit more. Release the hands towards the sides of the knees and come back up into a full boat. Cross your legs, hand on each knee. Spine comes upright. Just for the next few breaths, close your eyes and observe. Feet are fine, knees, hip joints, lower back, upper back. And the breathing is even through both the nostrils. Good. That's enough for this evening. So we go back into our starting position because we're going to do a little bit of pranayama and then relaxation. Take a water break if you need one. But coming back into how we started. Cross legs, warm clothing on. Those of you are using blankets, bring the blankets, put them by the side. So when you go to relax, you really make maximum use of the me time in and learning to relax. As you get ready, And the same nuances again. Backs of the wrists on the knees, index fingers and the thumbs link up. Chin slightly tucked in, but the spine is as straight at the back as possible. Eyes closed. Ribs moving. Outer edges of your feet pressing into the mat. Just keeping the mind busy with the body. And then the sitting bones. Under those layers of muscles, mainly the glutes. And you know that's where the sciatic nerve, left and right, passes through the outer edges of your thighs, splits above the knee, and all the way down to the toes. Good. This evening, we're going to do 3 rounds of the Ujjayi breath. So really making maximum use of the lower and upper respiratory system. From the base of your lungs to the back of the eardrums. Eyes closed. Talk you through. First round. Start with a complete exhalation. Pull in the belly muscles. Begin to empty the lungs as much as you can. Exhale, exhale. Squeeze the belly muscles. And then you inhale right to the top and hold. Pull in the belly muscles and hold your breath. And let go. Come back to the front, normal breaths. Normal breaths. Second round. Exhale fully, squeezing the belly muscles, emptying the lungs as much as you can. Exhale, exhale. Inhale to the top and hold. Pull in the belly muscles, hold your breath. Let go. Normal breaths. Third and final round. Exhale fully. Squeeze. Use the muscles. Inhale to the very top and hold. Pull in the belly muscles. Hold your breath. Let go. Normal breaths. Open your eyes and quietly lie back down into a full relaxation posture. So you're paying attention to your lower back. If need be, you keep your knees bent. Those of you using blankets, cover yourselves up. It's a wonderful way to start to buy into this me time concept. I'm lying here, nothing is bothering me, and my body and my mind in a full relaxation mode. If need be, keep the knees bent if the lower back is at all uncomfortable. The back is okay. We worked quite a lot with various postures today, so there should be no catches anywhere. Breathing in, breathing out. Go with eyes closed. Both the nostrils are open and working. And then use your imagination, visualize, and take your awareness to your lumbar spine. You're standing on your mat, real mini-me, looking up towards the lumbar spine, and you see in front of you the skin at the back. And we start to use our imagination, visualize. So the skin is out of the way, and you see the lower parts of the latissimus dorsi, big, powerful muscles covering the whole of the back of the rib cage as well. And then you remove those, and the first thing you see is the serratus muscles from the spine to the ribs. They help you to breathe and lift the ribs and drop them back as you breathe out. You let those go, running alongside the spine, quite close to the spine, is one of the longest muscles in the body, and it's called the longissimus. From way into the backs of the hips, all the way up side of the spine, right up to the base of the skull at the back. Longissimus right, longissimus left. Running parallel with that, but moving at the top towards the shoulder, is the quadratus lumborum. It almost looks like the remains of when we had wings, and allowing us to move the arms, move the rib cage. With both those layers of muscles gone, you come to scores of tiny muscles that link one lumbar vertebrae to its neighbor or beyond its neighbor, and it's masses of muscles all the way, lumbar spine, thoracic spine. These are the multifidi. Individually, you find it's multifidus. If you look it up, you see they're short, stout, strong muscles. So in your various postures this evening, you have worked, stretched, squeezed, flexed, all those muscles, and in some cases even inverted the area. But my recommendation is that supine twist for anything to do with the lumbar spine, and additionally anything to do with the digestive system, hip joints, the backs of the upper thighs, if all goes well, we may look at that region visually next week when we meet. But at the moment, you are simply observing, taking your awareness to those regions, and all you feel is nothing in there needing or calling for attention. So spending 10 to 15 minutes doing a supine twist with all its variations, at least once a day. It's in my book, that is super maintenance of the body. Hips, the lumbar spine, the digestive system, sciatic nerve, upper hamstrings. Good. Keeping your eyes closed. At the neck, turn to any one side and allow that ear to go and touch the mat. Then you rotate at the neck and guide the other ear to go and touch the mat. And then you come back to the center. Eyes may remain closed or open. Start to bring your knees to your chest. Wrap your arms around the tops of the shins. And as you breathe out, bring the forehead up towards the knees, knowing the muscles at the back being stretched fully. Pull the belly button towards the spine as you breathe out, squeezing the core of the body. Let go of the belly muscles. Let the back of the head go to the mat. And then again, 3 to 4 rounds of rocking from side to side. If you feel okay, drop right down to the elbow so the side of the rib cage gets a bit of massage there as well. Once you've done at least 3 rounds of that, you come back to the center, release your shins, and plant your feet on the mat. And from there, in your own time, you roll to any one side and come up in a sitting posture. I'm going to put us all on gallery as always, so we can see and say hello. Where is Sharon? Oh, there she is. Unmute yourself, Sharon.
Thank you so much, Sam. That was such a beautiful class. And I'm
Did you-
sorry to everybody else that I dominated the class tonight.
Oh, not
But
at
it
all. It was
really
very
helped.
good.
Very helpful, everybody. Katie, did you get that one? Yes, supine twist and see what kind of... So Sharon, yes, by all means, do all the ones that you're doing. But my suggestion would be, because you do a lot of running as well,
Yeah.
is do the supine twist, because those upper hamstrings and the lower hamstrings,
Yeah.
they need really a lot of stretch. And
It's so lovely. I need you to do a little 10-15 minute clip of you doing it, because like Suki and I were saying that we both try and do it most days, but it's
Yes.
never the same as when we can hear. We never stretch for as long
or
as what
hold
we
as
can
long.
hear you saying it to us, you know.
That's good. I feel useful then.
Well, you're always useful. And listen, happy birthday to Coral today. I
Thank
hope
you,
you're
sweetie.
okay. I hope you're all right today.
Oh yeah, it's been a different kind of day, but
Yeah.
you know, I normally I would have done. So I brought the roses, I bought
Fine.
special
What a
candles.
lovely husband you were.
Well, I was. She's gone. She had enough of me. So yes, life does change. It's changed considerably.
Yeah.
Anyhow, with my yogis, I keep going. So it's all good stuff.
That's good.
Sam, do you think this particular class you could put on YouTube or wherever you put your things for Sharon and everybody to access? Because if it was specifically for, that would be good to just repeat that one, right?
It's not a problem. It's been recorded. Once I'm able to move my coughs and ums and ahs out of it by editing.
Don't worry about your coughs and arms. We love those. We love that part of you.
The
That's what makes you
authentic
you. Honestly, just leave them on. We're not worried about those.
Okay, it will be on YouTube. It will be on your Patreon. And some of you, I hope you got the email which says I won't be doing the Friday morning Patreon anymore because I'm doing a podcast. So when the podcasts are ready, you're going to see more or listen to more of my ramblings, if you like.
Lucky
Very
us.
glad you're keeping the Wednesday night one going, though,
Yes.
Sam.
And
Yeah,
that
me
I
too.
will-
I love it, Sam.
Yeah, the thing
Yeah.
about any of these online ones, we have to, any one of you doing them, we have to keep them up because who knows what's going to happen as we go along and all these crazies doing their thing. And so we are going to need to keep the maintenance of the body through yoga and pranayama. And maybe
Yeah.
join the classes if you can, or
When I retire, I will definitely come to your Tuesday morning classes. Don't you worry, Sam. I'll be there.
I look forward to seeing you, but you better get in there early and mark your spot.
I know. I hear it's very busy. Very lovely.
Yeah, it is a busy class. It's lovely. I love it. You know, I thoroughly enjoy it. Wonderful. Good to
Thank you,
see
Sam. It was very relaxing. Thank you.
Well done. Thank you, Natalie.
Sam,
Yes, Marie.
before you go, Sharon, I wanted to you. For all of 2020, I listened to Sam's sciatic stretches on YouTube, and I did them 5 days a week. So he's got one on there.
Oh, okay.
It's
I love
36 minutes. It's
Yeah.
36 minutes. It has a relaxation, but you need the belt. But it does the
Okay.
same thing.
But
And
it's there on
brilliant.
YouTube. They're on
on YouTube.
YouTube's. They'll be on Patreon. Thank you, Marie, for
Right.
there. If you find Sam Rao on YouTube, there is something like 200 classes
Yeah.
in there.
Okay. Thank you, Sam. I will definitely look for that.
And
36 minutes. That's the key.
Okay. Thank you, Marie. Really.
Yeah. But remember,
You're like me,
remember-
it's very key. I'm like that when I do all the other my little Adrienne ones. I'm checking to see how long it is, trying to fit it in with my
Yes.
day. So,
well,
Yeah,
I make sure that the first frame tells you how long it is.
yeah.
But
And then
always,
that'll be
when
the
you
one that
use
you'll
my
find.
when you use my YouTube from now on, please share, like, and comment. Doesn't
Okay,
matter.
yeah.
I can manage whatever comment you make.
It would never be horrible, Sam. It'd only be gorgeous.
You can
Maybe
be.
something
You
saying
can-
something like crazy old man, but that'll be it.
Well, let's see. I mean, that it could upset somebody.
They don't know us, do they, Sam?
No, they don't know us. We work with that. So yes, Nicole, this is being recorded and it will be on, and I'll make sure you get the link for it.
Thank
Katie, good to
so
see you.
much.
Sarah, all well?
It's amazing.
Yeah, well done. Okay, time to go.
Namaste.
Thank you.
Thank
Eleanor,
Namaste.
Namaste.
Bye, lovely Sam.
week.
Bye,
Thanks, Sam.
everybody.
Namaste.
namaste. Good to see you all.